Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
All right, everybody, welcome back. We're coming up to the second half of our segment. This is Living Pain-Free. I'm Dr. Thomas Grove. Dr. Darrow's away from us here this week. We are excited to talk to you guys about your musculoskeletal orthopedic needs, right? Twisted ankles, arthritis, ligament, tendon, muscle, joint capsule, joints, head to toe, right? What we like to use is regenerative medicine, using the power of your body's own healing cells, platelet-rich plasma, stem cells, just a few to name there. What we like to do is do a proper hands-on physical exam, get a good proper diagnosis to start. Where is that pain coming from? From there, what we can do is implement regenerative medicine, simple injections. You walk into the clinic, get some injections, and you walk out and get to heal your body from the inside out, hopefully avoiding those unnecessary surgeries. So looks like we got a caller coming in to us here. We've got Laura from St. Pete's, Florida. Laura, how are you?
I'm okay. Thanks, Doc.
Of course. What can we help you with?
Well, I'm trying to understand. Well, I've been living with a terrible situation. It's continuing to get worse, misdiagnosed. I've listened to you talk about the herniations. I was in a bad car accident.
I'm sorry.
Over 3 years ago. And so everyone was focused on the back, and I'm like, well, you know, it's really the ankle. My ankle's been swollen. I was walking on the outside of the foot, and it was improperly MRI'd. The radiologist said potential gout. So up in Massachusetts this summer, I had another MRI, and it showed a split peroneal brevis tear.
Yeah.
And it seems to be, but it also does weaken the muscles and then makes the knee worse. Mm-hmm. I've had some myofascial work on my hip or on my ankle, and then when it does, the whole line up is better. You know, one, do you think PRP would be helpful and or stem cell? And really, I know you bone aspirate from listening to you for the stem cell, but seeing it's such a weight-bearing part of the body, yet small, what do you think PRP can help?
Yeah, well, these are really, really great points that you're bringing up. First of all, sorry you're going through this. Again, this is something that's a very common scenario. Man, these car accidents, those can be pretty nasty. The big question is, where are these symptoms coming from? And like we talk about every week, the imaging certainly can be helpful, right? We like to look at things like fractures and bone cancers and things that are deep in there that I cannot see with ultrasound. But really what I need to do, get you into the clinic, do a proper hands-on physical exam, stress those tissues. And for things like, the ankle, ultrasound is like the top dog. It is the best in terms of looking at that anatomy. Things like the hands, wrists, ankles, feet, there's a lot of anatomy in a very small space. So it's very, very important that we avoid any sort of vessels or nerves while we're injecting there. But what we like to do is do a dynamic stress test of some of these ligaments. So you mentioned the peroneus brevis tendon, which is more on the outside of that foot. It allows you to evert. It's on the pinky side of the foot. So it also helps with something called dorsiflexion, meaning you kind of lift your toes up off the ground every time you take a step. And these can be pretty devastating. I mean, even though it's a pretty small tendon, like you mentioned, it's a small area, but man, it can totally change how you walk, how you lunge, how you go upstairs. In the athletic world, a little brevis tear like this can, take you out for the season. It can be really, really devastating. And all of a sudden now maybe the knee starts to hurt, maybe the hip starts to hurt, and that can go all the way up to the neck. So the ankle can be a very, very important pain generator. But I treat these all day. I mean, peroneus brevis tears, these are like, again, I can't say 100%, success rate, but these are as close to a slam dunk as you get. What we simply do is you can look in that ultrasound to see exactly where that tear is. And again, that's correlating with your pain. What we can do is introduce some cells directly into that area, it's really close to the skin. It's like right underneath the skin. So I use a very tiny little 30 gauge needle for these. So these are not painful injections either. But again, compared to what the alternative is, right, which is just kind of letting this thing go. If you take a bunch of pain pills, these strong anti-inflammatories, maybe you kind of work your way through that pain, and now the tear gets worse and worse and worse, right? So what we'd rather do is, cut you off here and get some healing going, put you in a walking boot for a couple of weeks to optimize your healing. This is a very common scenario that we see here. But, yeah, I mean, gout after a car accident, I don't know about that.
Will it help with the burning? I mean, my foot's literally on fire. The heel, the outside underneath. And then by the end of the day, 4 or 5 o'clock, just I work at home, so staying in the house, it moves up the peroneal. There's also some knee issues from the accident. I was hit head on.
Oh, I'm sorry.
And so the ACL's ruptured per the MRIs.
Mm-hmm.
I don't have the pain on the one meniscus. The medial meniscus feels like it's starting to pop out. Mm-hmm. But I can touch and feel the peripheral nerves just by touching my fingertips on the calf without any movement. But putting pressure, putting weight on the foot itself, just on fire.
Yep. And
literally.
Again, that little tendon runs all the way up there. So that's, a pretty good chance of where your pain's coming from. But again, over the radio, kind of tough to tell exactly where it's coming from. But
exactly.
Based on what I'm hearing, though, this is something that regenerative medicine you should take a very strong look at to see if it could be a good option for you.
Okay. And you'd guide more towards PRP or stem cell or?
Yeah, and again, ideally, stem cells is going to be the best option that we have. PRP is still certainly good. Don't get me wrong. It's just typically you have to be a little more patient with it. It takes more treatments on average. It's just not as comprehensive of a treatment. Again, still good, but not great, right? Stem cells is kind of the top dog today in terms of, most amount of healing per injection, the fastest healing times, the biggest chance for
wonderful.
recovery. Yeah. Well, Laura, really appreciate your call. Hopefully we can get you in here and get you some help.
Yes. Sounds great, Doctor. Thanks so much.
Of course. Thanks, Laura. Good luck to you.
I'll be in touch with your office. Thank you.
Perfect. Excellent. Yeah, again, really good important point here, guys, right? So we see a ton of patients who have car accidents, and, man, that can be a ton of force that goes through the entire body, right? When I was in med school, we had a guy who came and gave a lecture, and we said, anytime you have a patient come in, they say they had a car accident, you got to think of that as a total body experience. I mean, that force is going through everything, right? We like to focus on, broken bones and maybe you have little cuts and things from accidents, but, don't forget about those internal structures, right? Especially things like whiplash injuries, right? Concussions, and we're dealing with, deep ligaments around the spine, supportive structures, joint capsules. That certainly can be a really, really painful process. But anytime that we're doing a history on patients, right, the car accident's a pretty common scenario where that's really where the pain started. So, we can really pinpoint exactly what pain's coming from before we try to make any sort of treatment decision. Okay. Looks like we got a call coming to us from Linda in Northridge. Linda, how are you?
I'm pretty good, except for my left knee.
Oh, no. And what's going on with the knee?
Oh, it was the good one until Dr. Darrow fixed my right one.
Nice.
3 or 4 years ago. And now when I can afford to, I'm going to come back and let you fix my left one.
Oh, I love it. I love it.
Well, yeah, you guys are great. Dr. Darrow is a fun guy, and he sure knows what he's doing.
Oh, yeah.
And I'm the working actress, and I had a little bitty part in The Last Showgirl.
Oh, awesome. Yeah, we love our active people. We got to get you back in shape here.
What's that?
We got to get you back in shape here with this knee.
Yeah, you're telling me.
Well, we love calls like that. Yeah, fantastic. Yeah, again, I mean, knees are probably the most common thing that I treat in the clinic. It's such especially if you're, moving around and you're an active person. Yeah, the knees a lot of times, it doesn't take much either. Sometimes it's just a little tweak. Sometimes you fall funny, you step funny. And then if you're really, really active, right, that's where we see, meniscus tears and joint arthritis and ligament strains and things like that.
Well, there's arthritis in there. I am a senior, and I am a trick roper. I rode horses in rodeos and fairs.
Oh, awesome.
Horse catches. Then I was a professional dancer, ballet, tap, and jazz for 35 years.
Oh,
so
wow.
I've used my knees a lot.
Oh, yeah. You've definitely used those body parts. No question about it. Yeah. And again, so someone like you, again, this is why I'm so passionate about this is, you're used to a certain active lifestyle. And if you end up having, joint pain or any part of your body that's causing pain and it's limiting your ability, to live the life that you like to do, man, that's really, really tough to swallow. We want to, get in there and get some cells in there, get you healed up and keep you active, right? That's our goal.
That's right. But I just wanted to say to your listeners, it works.
We love it.
After you get stabbed with this, oh goodness, then you got to go lay down. You can't just get up and charge around.
Now that is a very good point.
Let it knit. It takes time to do it, and then you can go gently, and it works. But you got to be gentle on it.
That is an extremely important point. Linda, thank you so much for your call. We really appreciate you. Glad you're doing well.
Thank you. Bye.
Bye-bye. So if we look at the reasons why regenerative medicine, doesn't work, right? It's by far people are just too active too soon, right? Remember, when we inject these structures, we create a little inflammation. Then we get into the tissue remodeling. We're actually growing new tissue. We're actually repairing tissue on a cellular level. And we don't want to be beating that tissue up, right? We like to talk about the analogy. Every time you put some grass seed down, right, you don't go and step on it right away. You got to give it a little time, right? Let that cellular tissue healing process get going, right? Let those cells get into some mature tissue there, get you some relief. But yeah, a lot of times people get a little impatient, right? I can relate to that. I'm not the best patient myself, but the more that you rest and the more treatment you get earlier, right, the higher success rate. So those are really good points. Looks like we got another caller coming to us here from Valley Village. We've got John. John, how are you?
Hey, good. Thank you. I was diagnosed with a lesion on my spine about a year and a half ago. It's the T1, T2. They want to do I've had an MRI 3 times. It's staying about the same size. They want to do it with contrast, but I always say no because I don't know what the point of the what's it going to get me. Can you?
Yeah, of course. So when you're looking at imaging, so John was referring to contrast. So when you're doing things like MRIs and CTs, contrast is something that you can track. So you can put it into a joint, for example, or you can put it into the vasculature, and that contrast will kind of paint the picture, paint the contour of whatever structure that you inject it into. So anytime people are getting contrast when you're looking for a lesion, if I don't know anything else, John, I'm guessing what they're looking for is to see if maybe there's like a cancerous lesion, to see how that lesion takes up the contrast. That could be one thing that they do, or sometimes they just put it directly into whatever that structure is to see how that contrast moves around. They'd be my guess. Did they tell you what the lesion is? Like, have you had a biopsy? Do they think it's cancer? What do they think's going on?
They haven't asked for a biopsy. The lesion is 3.3 centimeters by 1.2 by 0.9 hypertense lesion within the central cord level of T1, T2. They keep telling me they want to do it with a contrast, but I asked them, well, how will that help me? What are the possibilities? It seems to me they're not going to do surgery unless I'm in pain, and I'm not in pain. So what am I going to gain by it?
Yeah. So the big thing would be just we want to know what it is, right? Again, if you have got a lesion on your spinal cord, that could be a whole lot of different things. So really impossible for me to speculate in terms of what that would be. But, that's what the use of that contrast is for. Sometimes they'll give you images with and without contrast just to see if they can paint the edges, right? It'll actually fill in those sort of gaps with that contrast. That just gives them more clinical information to try to characterize what type of lesion that it is. So, yeah, anytime I hear lesions in bone, lesions in spinal cord, again, very good idea to get that worked up, and don't just, go living your life without it. Certainly could be nothing, right? But certainly could be something. So make sure that you continue that course and get some good diagnostic imaging. Okay, John?
Well, supposing they find the worst thing, like it's cancer, then what would they do? I mean, they're still not going to operate, are they, unless I'm in pain?
It totally depends on what type of cancer it is and the location of it, how big it is, right? So it doesn't have to be necessarily a big mass, but if it's a fast-growing cancer, that's something they'd want to get rid of. If it's a small mass, but it's maybe pushing up on something that potentially could give you permanent nerve damage, right? Those are the things that typically they're going to lend more towards the surgery, right? That's a general
is there
sort of.
any other recourse, like your PRP or your stem cell? Would that be useful in something like this at all?
Again, if you're not having pain, I necessarily wouldn't be injecting that, right? So anytime you have got a lesion and it's not causing pain, I would not be blindly injecting it. I'd want to figure out what that lesion is first.
Mm-hmm.
Okay.
Okay. All right, fine. Thank you.
Excellent. Thank you so much for your call, John. Yeah, very, very good point here, guys, in terms of, medicine, right? So everyone thinks that, I'm going to talk everyone into treatment. That's like the furthest from the truth, right? At the end of the day, right, I'm not somebody that has very little training. I have dedicated a huge, huge chunk of my life to my medical training. I am a physician. I am board certified. I am fellowship trained in sports medicine. I have spent thousands and thousands and thousands of hours in the operating room, outside of the operating room, looking at the entire clinical picture, right? So when I think something, needs to be worked up, and I don't think stem cells or platelets are going to help, I certainly will, guide patients to that spot. Again, we had a patient this week, again, just kind of a weird sort of mass that was in a painful area that I couldn't quite identify in ultrasound. So that's something, hey, listen, we got to work this up. We got to figure out what this is first. And again, we're not going to just blindly inject into something that could maybe need surgery, or at least give us an idea of exactly what's going on. So things like, extensive imaging, if we're looking at things like masses that could potentially be cancerous, or they're just in kind of tricky areas, right? If you get a little mass and it's pressing up on a nerve, that could be something that, might need to be surgically addressed, might not, but we want to make sure we're being comprehensive and we're being safe for our patients. So good talking points there. We're coming up here towards the back end of our second half of the show. We got a couple minutes here left. Love to get you guys giving us some calls here. Let me go with the number one more time here. Call us live in the studio. Number to call, 866-870-5752. That's 866-870-5752. If you guys call, we'll give you a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And if you'd like a free consultation with our staff over the phone, give us a call. We're at 800-300-9300. That's 800-300-9300. And if you want to shoot us an email, if you're too shy to talk on the radio, check out our website. There's a spot on every single page to shoot us an email. And while you're there, check out some videos of us doing these procedures. Check out the hundreds of pages of educational content. Our website's www.jointrehab.com. That's www.jointrehab.com. Got a really fun case to discuss with you guys here today. Had kind of an interesting scenario. I had a gentleman come in, I don't know, maybe he's about his 50s or so, ended up having some hip pain. So he came in and he said, man, I'm having some pain. He kind of grabbed over kind of the outside hip area, and he's like, I had some hip pain. I went to my ortho surgeon, and, we got an MRI, and he's like, hey, man, you got bone-on-bone arthritis. We got to replace this joint. And he's like, I don't know, something just doesn't feel right here. So then they went to me. We did a proper hands-on physical exam. And, he's got some arthritis, right? He's got just a little bit limited range of motion, but not bad. None of that pain was actually coming from his hip. So, again, getting back to bases, putting your hands on patients, it is so incredibly important. What I found in this gentleman, all right, he had a little bit of pain over something called the iliac crest, okay? It's kind of one of the pelvic bones that's right above the hip joint, and you got a lot of muscle attachments in that area. So then I threw the ultrasound on him, and again, looked at the hip joint. Yeah, you got some arthritis, but on the physical exam, not really causing your pain. But when we palpated, all that pain was coming from little muscle attachments, right? Those are called an enthesis, and so right along that iliac crest. So on the top side, you got some of your abdominal muscles. For him, it was something called the external oblique muscle. And then right below that, okay, you got a couple muscle attachments that come down by the buttock area. One was called the gluteus medius, and the other one is called the TFL, the tensor fascia lata. And again, these are very common scenarios, right? This is an active guy doing a more of a history there. Ended up getting maybe into some some racket sports that he wasn't used to doing. This is such an easy thing to address. Again, we did one treatment on this gentleman. He came back 2 weeks later, and he was back in business and totally saved him from needing a surgery. But again, you're not going to really find the source of somebody's pain if you're not doing a proper hands-on physical exam. And again, using that ultrasound, man, what a fun tool that we can use. For this gentleman, I believe we used 30-gauge needles. It was a very, very small needle we could use because it's so close to the skin. I can visualize that needle directly as it's attaching down to that bone. And again, all we're doing is we're just putting some healing cells into an area that's got a little chronic inflammation, right? So we actually get to heal that tissue up, save a gentleman from a surgery that otherwise would have been a pretty easy sort of guy to get into the operating room, right? You've got pain around the hip, right? And we do an image and we see an MRI. You see some arthritis. Let's just do a joint replacement. But you got to remember, if that pain's not coming from the hip, that surgery wouldn't have done a dang thing for him, right? That thing just would have potentially made his problems worse. God forbid he had a complication. He just had a little muscle attachment issue on the outside of that hip. So again, very glad that we got to save him from that unnecessary surgery. Looks like we got one more caller coming in here. We got Jeff coming to us. Jeff, how are you?
Doing well, thank you. The reason for my call is I've had lumbar problems for quite some time. At one time, I had a 8-millimeter bulge between L4 L5, which is now must have been, reabsorbed before. But now I have fairly severe spondylolisthesis, L4 L5, and I also have stenosis, which is causing nerve impingement. So I'm starting to limp, and they want to do a double fusion, laminectomy and fusion, and I have discussed with the orthopedic surgeons, would stem cell help at all? They say, no way, it's not going to help your condition. So my question is, will it?
Yeah, so Jeff, that's kind of a tough thing to answer over the radio without doing a proper hands-on physical exam. So you definitely named some things that could be things that only surgery is going to address. So if you've got a big spondylolisthesis, you've got true nerve impingement, meaning the spinal cord, those spinal bones, are slipping and pinching on that spinal cord. Nothing that I'm going to do that's going to magically put those bones back in place and unpinch that bone getting up onto a nerve. But just because you have that on imaging does not mean that's the cause of your pain. And the only way I can really tease that out is bringing you in for a good hands-on physical exam. Okay, so that'll give me a lot more information. But in terms of, those sort of injuries, big disc bulges, big spondylolisthesis, which is basically just a little fracture and a little bone of the spine, and the whole spine can kind of slip forward or backwards and pinch on the spinal cord. And those things definitely can cause, true nerve impingement, true nerve weakness, true loss of sensation. And those are things, maybe sometimes a nerve study could be a good idea there to see if the nerve's actually damaged. But again, what we do is locally inject structures that we can strengthen up and give you some good, strong structural support around those issues. So I certainly inject a lot of people who had spondylolistheses, and we can get really good results with it. But yeah, the question is, do we need to do surgery like right now because we're having a nerve that's, being damaged, right? So that's the big question we got to tease out.
Well, I do have an MRI. It's probably getting close to 2 years old, but that's what they use for a diagnosis. And now, more recently, I've got a lot of pain in my right hip, and that's where I've got the.
Jeff, looks like we're coming up to the end of the show here. Jeff, hang out here. I'll talk to you on the phone here. I'll make sure I'll get your phone number here. I'll give you a call. That's the end of the show here, guys. Thank you so much for tuning in. Again, this is Living Pain Free. I'm Dr. Thomas Grove. And if you guys are ready to call for a free consultation over the phone with our staff, check us out. We're at 800-300-9300. And check out our website, www.jointrehab.com. See you next week.
You've been listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870 The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.